Our first guest, we're always excited to have him on the Oakland County MegaCast, but he's under a little bit of a time crunch because, as much as we think Dr. Jamie Taweel should be a permanent guest and have a spot here on the Oakland County MegaCast, well, guess what? He is a doctor and he also has a practice to run.
Oh, yeah.
But we always appreciate your time and good morning. Thank you for carving out a little bit of that time to be with us here on the MegaCast.
I honestly think you guys have just watched me turn completely beet red in real time.
It doesn't show through the camera. You're okay.
I really hope not. How are you guys?
We're great, Doctor. How are things going with you and everyone in your office?
Things are going well. Things are really picking up. It's been busy, very, very busy. People are starting to come out of their shell a little bit. So I'm getting, a lot of people trying to catch up on past physicals. Still going through all of that. It's been a rush. Been really awfully busy.
So, and what is the timeline? I know that when I made my doctor's appointment recently, it was 3 to 4 weeks out. So, are you seeing a backlog, and should people be aware of that?
Yeah, there's been a backlog certainly because people that need to get their physicals for their insurance companies, those that work for companies that would reimburse you if you were to get your physicals done during a certain time, they're anxious to get those taken care of. People that just need to do checkups and follow-ups to get refills on their medications. Some patients we need to see before we can refill their meds so we can draw labs. So those are all coming into play. Not to mention the fact that we're also doing all of the things that to prevent, COVID from spreading within an office. Should someone that's infected make it through, we have to do the screening at the door, and we're trying to limit the amount of people we can have in the waiting room. So it's slowed things down a bit. So that also contributes to the grind a little bit.
So are you also seeing patients via Zoom or, like telehealth? Are you still doing those for people?
I am actually. I blocked off a day for doing just those types of calls because I do have patients that want to get seen right away. And I am booked out for quite a bit just because of a lot of things. Also, I had another physician in this office who unfortunately had to move out of state for husband's career change. So that really kind of slowed things down a bit as well. But I blocked off a day on Wednesdays so that I can do that just for patients that either need to be seen rather immediately, need refills, and just can't wait to be seen. We're also trying to block off some time, and I'm adding to the beginning and end of my days to try and accommodate people. It was really slow when COVID hit, and now we're in overdrive and just doing the best we can.
So Dr. Jamie Taweel with us here on the Oakland County MegaCast. He is the internal medicine specialist over at Grand River Medical Associates. As you said, we're going back into fall time. Flu season is upon us. How important this year, more than previous years, will it be for people to get the flu vaccine? Because could you get COVID and the flu at the same time?
I think it's certainly possible. You definitely want to get the flu shot. I'm going to tell you that every year. Every patient always says, do I really need to get the flu shot? And my answer is always the same. It's my job. I'm a doctor, and I'm always going to push the flu shot. You're really hard pressed to have me tell you that you shouldn't get it. But especially more so this year. I do think hopefully the flu transmission will actually be a little bit less as we practice the social distancing, wearing the masks, doing all the stuff that we've been doing. And I think those are going to be new habits that people are going to keep for a bit. So I hope that will reduce the transmission of the flu, but the flu shot is necessary. And also to, you don't want to have a co-infection of, flu and COVID. I think that would be, I'm hoping that does not occur often.
Right. So what do you say to your patients that say, but if I get the flu shot, I get sick. So it gives me the flu. I'm not going to get it.
So people get the flu shot and they feel rather crummy rather immediately, and they blame it on the flu shot. But if you were to get the flu from the flu shot, it would take a lot longer than the rather immediate thing. Your body does mount an immune reaction to the flu shot. It does happen on a local level, which is why your arm tends to ache a little bit after you get the shot. But at the same time, it also happens to systemically as your body mounts antibodies. That's what it's trying to do. You're basically, for lack of a better example, showing a picture of the bad guy to the authorities and letting the authorities mount a response so that if the bad guy actually shows up, they know what to do. So during the time your body is mounting that response, you tend to feel a little bit, it's been reported lethargic, sluggish, things like that. But to be as ill as you were when you got the flu, should not happen. And I think people oftentimes misattribute things to the flu, which is, unfortunate, because I want them to, I always going to push the flu shot.
I'll say I used to get it, and I haven't had one in several years. But going through COVID this year, I'm with you. I think I'm probably going to suck it up and get it, just because I'm a baby when it comes to needles. And I also hear the stories about, the flu. There are different strands, and it changes. So the shot that you get for the flu may not actually protect you from the flu. Is there any validity to that?
Absolutely. I think a couple of years ago, I think we missed the mark altogether. And if I'm remembering correctly, please don't quote me on that. But there was a year when the strand and the mutation of the virus that hit was a lot different than the flu vaccine that was given, which is why now they do different combinations of the flu to try and to better get people prepared. But it's also hit or miss. There's different strands, there's different strains, there's different mutations, there's different things. People can get a flu shot, feel like they're protected, and then get a pretty bad pneumonia from a bacteria. There's always these options, but what we're trying to do ultimately is reduce the risk as best as possible, specifically in our more high risk population. For example, the elderly, people that have certain illnesses, just like with COVID, when people had conditions that were made them higher risk patients. This is the same thing with the flu. So we're trying to just do the best we can, but it's not always going to be 100%. That's unfortunate. But at the same time, we are reducing the risk, and the flu vaccine does work.
Dr. Jamie Taweel joining us from Grand River Medical Associates. He's an internal medicine specialist over there today with us on the Oakland County MegaCast. So Dr. Taweel, when is the right time or right period of time to get your flu shot? I spoke to someone recently who said they were going to schedule a time to go get their flu shot, and they were told, "Oh no, it's a little bit too early." Is there a right period of time to get that shot?
I don't think there is. So people might disagree with me on that. Some people say to wait a little bit longer. The flu, once you get the vaccine, you are immune to that flu, that particular strand. I don't know if they're going to change the vaccine on people, but we've got them in. We're giving them out now. I'm recommending people get them as soon as possible, and just to avoid any type. I have a feeling that there might be a shortage as things go on if more people are trying to get the flu shot this year. So I don't personally believe there's a particular time. Once you get it, and you're good for that year. So I think my personal opinion is the sooner that you get it, the better. I have heard people suggest otherwise, and I don't know the rationale behind that. I'd have to double check, but perhaps I'm misinformed. But to the best of my knowledge, getting it as soon as possible is usually the best bet.
One of the things I'm starting. Oh, sorry. One of the things I'm starting to see is I think even Kroger is jumping in on people getting the flu shot. You can maybe go to, like a drive-by location now that they're offering this year, or CVS, or there's so many places to get flu shots. Doesn't matter where you get it or who. I would imagine who you get it from is important as well, but it doesn't necessarily need to be from a doctor's office, right?
No, it doesn't need to be from a doctor's office. You can get it from anywhere. A flu shot can be done from the public health department. Most pharmacies that have minute clinics, or I know that CVS, things like that, Walmart. As long as you're getting it, you're getting it. And I think that what matters is more importantly is the manufacturer and who's making the flu shots and producing them. And there can be done some research into that, but the CDC essentially sets the strand for the flu vaccine, if I'm not mistaken, and that ends up being what people get. So you're not going to get a lot of variability depending on where you get it done. So they're trying to make it as convenient as possible so many people can get them. So, if you're already at the doctor's office, you're already going to get your blood drawn, you're going to get the flu shot. But if some people can't get to the doctor's office or don't want to, make an appointment, or if I don't know if some offices will do, my office specifically due to COVID, we are asking that people call ahead so that we can schedule them in so that they're not just kind of coming in the door. We're trying to, again, limit the interaction between people so that, sometimes doing it at a pharmacy might be a better option. And there's no risk to doing that.
And if you're already backed up and extremely busy, it might be better to alleviate some of the lines and the backup at the doctor's office to give you time to work with, some of your patients that are in desperate need of your services.
Well, yeah, absolutely. I mean, I don't need to be present for a flu vaccine to be given. So certainly if you come and I'm not there, or if I'm in a room, the staff will do that. They'll take the appropriate information down. They'll get the permissions. They'll explain to you the risks, and they'll administer the vaccine. So it can be done, which is, obviously why they're being done at, Kmart, or sorry, Kmart, geez, Walmart.
You just kind of showed your age right there,
I
because
know, I
there are
really
so
did.
few Kmarts left today, right?
Oh my God! Here I am. We read again, and here's the great here's the good thing blown up. So no, Walmart and CVS and things to that effect. I mean, that's why you don't need a physician there as well. And certainly, it does help with things, but the flu shot's a relatively quick process. It can be done relatively smooth. We haven't had any real backups in my office specifically to limit. We've never had to turn anybody away for that. I think the biggest problem we're having right now is keeping it in stock. People are really requesting it this year.
There's one of the positives coming out of COVID then, right? Doctor, I have a question for you, because here at Civic Center TV, every time we come in, we do take our temperatures and we do the health screening. You're doing it at your offices. College campuses are coming up with different protocols. Some of Oakland University, I think they have that button that the students are wearing to help monitor their health. Do temperature checks really work? Because if you're asymptomatic, will that even pick up through a temperature check?
Well, asymptomatic by definition is you have no symptoms. So a temperature check would come back normal. And yeah, there's still going to be spread. But there are people that have, we're trying to, again, reduce the risk the best we can with what we're doing. People that have fevers are known to be a bit higher risk patients. People that may have it and be in a particular state in their pathology to be more contagious. So temperature checks do help. They do reduce things to a degree. I mean, are they effective 100% foolproof? No, certainly nothing is at this point in time, but it does improve things a bit. And if you do have a fever, then you should be staying away from people. If you have a fever and you come to my office, unfortunately, we're going to recommend that you get screened for COVID, and we're going to recommend you self-isolate till we get results.
So that also brings me to fall allergy season. We kind of went through this in the springtime. For those that get fall allergies, or sometimes you start to develop them as you get older for the first time, but it seems like everyone is so freaked out now because you fear that you could possibly, is it COVID, is it not COVID, or is it just my allergies? What are you telling your patients?
I'm telling patients that the one thing they know better than anybody else, even more than me, is themselves. So if they feel that, hey, this is the same thing I get every year around this time, then it's pretty obvious it could just be their allergies. But if they're getting things that are a little bit different, a little bit off the beaten path, or something they're not used to, such as I'm getting a fever, allergies typically don't present with huge high fevers. So that's a bit of a red flag. They have, issues with their throat where they feel like it's really sore versus just scratchy. Those are, things that are a little bit different. I would suggest things that are different. You know what I mean? Allergies are also very situational. In other words, if you go into areas, as this season hits, people allergies kick up. But if they go outside, do they get worse? Does it get worse the more they stay indoors? Different types of allergies, as opposed to someone that's being ill from perhaps COVID, they would have those symptoms for quite some time, and it wouldn't immediately be, it wouldn't be as variable.
Do you recommend some of your patients get tested for allergies to know exactly what is their trigger point? So if anything, it helps them navigate to this COVID time if they're extremely concerned.
Oh, certainly. I think everybody should get tested for allergies if they're having issues or recurrent sinus infections, or they have significant symptoms. Allergies can be pretty severe. And they do, as you said, they do present as you get older. I know mine have. So I do think that it's worthwhile to get allergy tested to see if you can avoid those things. And then if you can't avoid those things, to at least get it treated and be able to say, hey, listen, I've been avoiding these things and I'm still not feeling well. This may not just be allergies. This may be something a little bit more concerning. Let me go to the doctor and see what's what.
Dr. Jamie Taweel joining us today on the Oakland County MegaCast. He is an internal medicine specialist at Grand River Medical Associates with us today on the program. In terms of children, is there any difference in what parents should be looking out for as their kids are going back to school? Many of their kids are in person, so they're around usually just their own cohort of people, but they're around people that are around other people that are around other people. what should they be looking out for? What checks can maybe parents do regularly at home on school days and not on school days to keep an eye on their kids and make sure that their kids aren't showing symptoms of COVID-19 or maybe putting themselves at risk?
That's a tough one because it gets different as kids get older. At different ages, kids show symptoms differently, and a lot of it is not only how they appear, but how they act. If a kid's be a little bit more lethargic, or if a child's having a little bit more, a baby's a little more fussy or a little more lethargic, that's going to be a significant thing as opposed to a child that can speak and actually convey their symptoms. I think most importantly, it's looking for a change in patterns, really. Again, parents know their children, so they know, hey, I have people that come to me all the time and they describe something that may be simple. And I say, all right, this doesn't seem like anything significant. And they look at me and they say, no, listen, I know myself. This is a change. This is something that is not normal for me. And then my antenna goes up and I think we need to chase it down a little bit more. And I think that parents should also do that with their children. Again, I'm no pediatrician, but any change in patterns is always going to be something worth raising the antenna. And I think it's worth looking into. Again, change is also with regards to temperature. If the child's becoming more lethargic, more sleepy, more fussy as an infant or as a toddler or a younger child, just basically just going to use their words and tell you, like, I don't feel well. And is it something that they usually complain about? Is it something that's kind of along their radar, or is it something that's a little bit different? It's hard to tell. And I think it's just worthwhile to take everything as serious as possible.
Dr. Taweel with us here on the Oakland County MegaCast. How many more months into this? And I know we had you on before back in June talking about hand sanitizer. Well, the FDA continues to extend its ban list because more and more hand sanitizers are making that list. I think there's over 100 brands on it that I saw the other day. I was on their website. And it's so hard for us now to find those brands that we are comfortable with, like Purell. So what should people be looking for in a hand sanitizer? I know it's because sometimes, some of the ingredients, we just don't know what they are. And we're like, they're selling it at the drugstore. It's safe.
Yeah, I think you need one that's going to have an alcohol content of, I want to say 60%, if I recall correctly. I have to double check those numbers. And I believe a 60% alcohol content is going to be ultimately, I think, the most important thing for preventing the transmission of COVID. Everything else, I believe, is going to be just filler in terms of, does it have aloe vera or does it have, et cetera, et cetera. There's the list for things that were banned because they were made in either unsafe conditions or had particular chemicals that made them higher risk. So obviously keep a close eye on that ban list. And I don't know if they're necessarily doing FDA approval for, is there a seal that they're putting or a stamp that they're putting on hand sanitizers? I mean, so many people are just giving away hand sanitizers, companies that are just giving it away as, products, like a company that has their logo on something that they're just giving those away. So I think when you get those, you have to look for at least a minimum 60% alcohol content just to make sure that it's going to be effective enough.
I do have a few of those. I have hand sanitizer stashed in so many places. It's crazy.
Everyone.
So I will. I'll ask you this because I think this is another thing so many of us are going through right now. I was lucky enough to find disinfectant spray. Again, it's not name brand. I don't remember the last time I actually saw a name brand Lysol anywhere, but it says kills flu virus and 99.9% of germs. So when it says flu virus, that doesn't necessarily mean COVID, correct?
No, it means it kills what they tested. So you can't trust what it says unless it tells you what it's actually tested it against. Now, I think it's safe to say that if it kills the flu virus, it's likely to kill most viruses, including COVID. But without distinct, testing that suggests that this particular chemical kills it, you can't say it for sure from a medical legal standpoint. But if it kills the flu virus, it should be sufficient enough to kill COVID, I would believe.
Well, I tried to attack it on a multifaceted platform. So usually I wipe it down first with a hand wipe, which I will say again, like the good ones are hard to get by, but sometimes I even use baby wipes. But it's like whatever you have. I'm like, hey, if it's good enough for a baby, it's good enough for the door handles. Like I wipe down before they get in here in the studio. I wipe down the door handles. I wipe down the studio, and then I spray after it as well.
Absolutely. I think, look, people often feel like there's like one thing they can do and that's all. And my suggestion is always going to be anything you do is going to be good. You know, you're not going to make your numbers zero, you know, in terms of your risk for getting things. And just being a human being is, you know, you can't make your risk zero. But what you can do is lower that risk as much as possible. So anything you do that's going to maintain, you know, hygiene, proper practices, things like that, you're going to lower those numbers. And that's all we're trying to do. People think, the masks don't work. Well, the masks don't work 100%. No, they don't. But what they do is reduce the risk. They lower those numbers. So, you know, if you bought a lotto ticket and you could do everything you could to make sure you're increasing your chances of winning, you're going to do that. There, you know, flip that around. Anything that you could do to lower your risk of a terrible infection, you know, why not do that? You know, the mask is not going to make it zero, but what it's going to do is lower those risks. So why not do those things that are going to be for the benefit of everybody?
Doctor, I know you have an extremely busy schedule, and so we don't want to take up much more of your time. We appreciate it as always. But anything that we didn't ask that people should know right now, or any of your patients, anything we should get out there?
Same as always, practice and maintain social distancing, get your flu shots, make sure that you're calling your doctor if you have any concerns. There's no such thing as a stupid question for a physician. We get paid to deal with these things. You have concerns, always get a hold of your doctor. They'll tell you whether or not it's something worth worrying about. You know, peace of mind is going to be more important than anything else. So I'm always going to recommend that. And as always, I really appreciate you guys having me on and letting me talk. This is very important to people get these questions answered. So I'm glad I'm able to do that for you. And I certainly appreciate you guys giving me the platform as always.
You're always welcome here on the Oakland County MegaCast. And just so you know, I'm old enough like you to remember Kmart, and I remember when the headquarters were across from Somerset Mall. So we're all in this together.
Oh man, do I remember that.
Have a good day. Thanks again for taking time. Stay safe, stay healthy. We appreciate having you here on the Oakland County MegaCast. Dr. Jamie Taweel with us. He's the internal medicine specialist, Grand River Medical Associates